Leuprolide is commonly used to treat advanced prostate cancer by reducing the amount of testosterone in the body, which is necessary for the growth and spread of most types of prostate cancer. This can help slow or stop the growth of cancer cells and relieve symptoms such as painful or difficult urination. It is important to talk to your doctor about the risks and benefits of this treatment. The Leuprolide 4-month syringe kit is typically administered once every 4 months, and the optimal time to take it should be determined by your healthcare provider. Before starting to use Leuprolide, make sure to read the patient information leaflet from your pharmacist. This medication is given by injection into a muscle by a healthcare professional, usually once every 4 months. It slowly releases the medication into your blood over a 4-month period. If you are using this medication at home, be sure to learn all preparation and usage instructions from your healthcare professional and the product package. Remember to wash your hands and properly mix the medication before injecting each dose. Change the injection site each time to lessen injury under the skin. Use this medication regularly to get the most benefit from it, and mark your calendar to keep track of when to receive the next dose. During the first few weeks of treatment, your hormone levels may go up before they go down. This is a normal response to this medication. If you have prostate cancer that has spread to the spine or caused urinary blockage, you may require closer monitoring by your doctor, especially when you first start treatment. Tell your doctor right away if you have any bone pain, numbness/tingling/weakness of the arms/legs, blood in the urine, painful/difficult urination, unusual weakness, or inability to move. Side effects of the Leuprolide 4-month syringe kit may include hot flashes, increased sweating, tiredness, swelling of the ankles/feet, increased urination at night, dizziness, or mild burning/pain/bruising at the injection site. In rare cases, shrinking of the testicles, breast tenderness/swelling, or reduced sexual interest/ability may occur due to lowered testosterone levels. It's important to talk to your doctor if you experience any of these effects. However, many people using this medication do not have serious side effects, and it has been prescribed because the benefit to you is greater than the risk of side effects. It's important to tell your doctor right away if you experience any serious side effects, such as new/worsening bone pain, easily broken bones, increased thirst/urination, mental/mood changes, symptoms of a heart attack or stroke, seizures, fast/irregular heartbeat, severe dizziness, fainting, or signs of a serious allergic reaction. If you notice any other effects not listed, it's important to contact your doctor or pharmacist. Before using Leuprolide, make sure to inform your doctor or pharmacist about any allergies you may have, as well as your medical history, especially if you have diabetes, heart disease, high cholesterol, or mental/mood problems. Leuprolide may weaken your bones and increase the risk of bone loss, so talk to your doctor if you have osteoporosis or any risk factors for osteoporosis. This medication can also affect the heart rhythm and may cause dizziness, so be cautious when driving or using machinery. Additionally, it can affect fertility in males and should not be used during pregnancy. It is important to use reliable forms of non-hormonal birth control while using this medication to prevent pregnancy. If you have any concerns about using this medication, consult your doctor for more details. When taking Leuprolide 4-month syringe kit, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Also, do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, this medication may interfere with certain lab tests, which could potentially cause false test results. It's crucial to make sure that lab personnel and all your doctors are aware that you are using this drug. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. It's important not to share this medication with others. While using this medication, it's important to have regular lab and medical tests such as blood testosterone level, PSA blood test, and blood glucose. Make sure to keep all medical and lab appointments and consult your doctor for more details. Remember, it's crucial to take each dose of the Leuprolide, 4-month, syringe kit as prescribed. If you happen to miss a dose, be sure to consult with your doctor or pharmacist for a new dosing schedule. It's important not to take a double dose to make up for a missed one. It's important to store the Leuprolide, 4-month, syringe kit at room temperature, away from light and moisture. Avoid keeping it in the bathroom. Once mixed, use the medication immediately. Keep all medications away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. Consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.